All right. Hello, everyone, and welcome to Infoway's Benefit Evaluation Collaboration Network's webinar. Hope you all had a great summer. We're very excited to kick off the fall with today's webinar on a very recent piece of research looking at the diffusion of smart devices for health in Canada. My name is Sakira Thatar-Malingam. I'm the Manager of Evaluation Methods at Infoway, and our agenda is very simple today. I have a couple of updates for the BE network, and then we'll jump right into our feature presentation. It's great to see so many new participants today on the line, including those that are returning members of our BE network, as well as new members. For the new participants joining, the goal of Infoway's Benefit Evaluation Collaboration Network is to connect jurisdictional leaders, evaluators, and researchers to share best practices, results, and other insights focused on evaluation in digital health area. We have regular webinar series to share each other's work, such as this one. You'll also receive regular updates on noteworthy evaluation-related activities that are on our radar in the digital health space. You can visit our website through the link you see on the screen to stay up to date. We will be posting the presentation from today's webinar on there as well. Our membership is continuing to expand and grow, and we invite you to join us or share information about this network with anyone who may be interested. To join, please email your interest at evaluationservices@infoway-inforoute.ca. Additionally, if you're working on interesting digital health evaluation activities that you want to share with this network, please feel free to contact me and we can facilitate an opportunity through this forum. We have one more Infoway news to share before we move on. We're very excited and looking forward to the 2017 Infoway Partnership Conference taking place in Calgary from November 14th to 15th. The Partnership Conference will highlight interoperability and new programs and initiatives happening across Canada. It's an opportunity to share successes and lessons learned and to connect with Canada's digital health leaders and international experts. And you can take advantage of lower rates by registering before October the 13th. I encourage you to visit the link on the screen for additional details. And before we get started, some housekeeping. Your lines have all been muted, but I do encourage you to use the Q&A function in the bottom right-hand corner of your window to type in your questions to the panelists throughout the presentation. And when we get to the Q&A period, I'll be posing those questions on your behalf. All right. So now, we're very pleased to have Guy Paré on the line with us to share results from his most recent study on the diffusion of the smart health devices for health in Canada. Guy Paré is a full professor of information technology management and holds a research chair in digital health at HEC Montreal. His current research interests involve the clinical, organizational, and economic impacts of telehealth applications, electronic medical record systems, and health information exchange projects, as well as barriers to adoption and implementation of health IT in the Quebec healthcare system. His work has appeared in top-ranked scientific journals, and he's presented at several international and national conferences. Professor Paré's expertise in health informatics has been sought by numerous organizations, including the World Health Organization, the Department of Health in France, Canada Health Infoway, INES, and the Quebec Ministry of Health and Social Services. He was elected a member of the Royal Society of Canada in 2012. I will now turn it over to Guy.
Thank you very much. Hi, everyone. It's my great pleasure to share with you today the results of this new study on consumer use of smart connected health technology in Canada. But before I start, I'd like to acknowledge the contribution of a number of people. I would like to thank my co-investigator, Claire Bourget, who is Director of Marketing and Research at CFRIO. And I would also like to acknowledge the contribution of many people from both CFRIO and Infoway, including Chad and Casey, who provided valuable input throughout the study. Last, I would like to thank Infoway for its financial support. So the agenda is quite straightforward. I will start by a bit of context before I present the research objectives. Next, I will briefly present how the study was conducted Then I will describe the key findings and their implications and contributions. And I will conclude with the presentation of the study highlights. So as you may know, there is a growing movement related to self-tracking. Self-tracking is defined as the practice of systematically recording information about one's health, diet, or activities, typically by means of a mobile phone or a digital tablet, so as to discover behavioral patterns that may then be adjusted to help improve one's physical or mental well-being. So tracking one's mood, caffeine intake, sexual activity, teeth brushing are becoming common practice. Today, the combination of matrix, self-improvement, and mobile technology make it easier than ever to collect, analyze, and use data for prevention and maintenance of wellness. In that regard, a recent study by Royal Philips has revealed that innovative technologies such as mobile apps, wearables, fitness device, and medical monitors are seen as a way to improve care and let people better control their health. So in the present study, we define smart connected health technology as a set of technological tools such as medical devices, sensors, and mobile apps that allow to objectively measure vital signs and medical parameters such as heart rate, blood sugar, blood pressure, body temperature, as well as other aspects related to well-being, such as calorie intake, sleep patterns. With this in mind, the present study examines Canadians' use of mobile apps and smart connected devices to monitor aspects of their health and well-being. We must note that this is the first national survey of its kind in our country. More specifically, the study aims to identify the following: the profile of Canadians who self-track aspects of their health using either smart devices or traditional methods, as well as those who do not self-track. The adoption rate of mobile apps and smart devices, the nature of health aspects that are being tracked, the motivations for using mobile apps and smart devices, data sharing behaviors, intention to continue using these devices, and the barriers to adoption. In terms of methodology, we first developed a French version of the questionnaire instrument based on a review of the extant literature on that topic. The instrument was pre-tested with 16 adults before it was translated in English. Once the questionnaire was available in both languages, it was pilot tested with 50 participants from the Nielsen Company's web panel. Then survey data were collected from the same panel in early 2017. The final sample is composed of 4,109 participants with a credibility or confidence interval of plus or minus 1.6%. Data was weighted to the most common recent Statistics Canada census data according to age, gender, and region. And finally, the average length to complete the survey was 12 minutes. Throughout the presentation, I will make comparisons with other international surveys on this topic. This table indicates that the present study is the largest ever conducted with a population of adults 18 years and over. So one of the first things we did was to compare the profile of the sample with the whole Canadian population. So as you can see on this table, our sample is representative of the Canadian population with regard to all attributes except education, where we find that our sample is slightly more educated than the overall population, which is kind of normal for this type of study. And with regard to perceived health status, in fact, our respondents seem to be a bit more realistic about their perceived health condition compared to a Health Canada survey that was conducted in 2014. I would also like to signal that 1/3 of our respondents reported having one or several chronic diseases. According to our findings, 78% of Canadian adults own a smartphone and used it to download mobile apps, and 57% own a tablet computer that allows them to do the same thing. Overall, 86% own at least one of these devices, and those results are similar to those reported by the CRTC in 2016. So one of the most interesting results is about the respondents' self-tracking behavior. So in terms of those behaviors, there are three distinct profiles of adults that based on our survey. The first one is what we call e-trackers. So e-trackers are those who use one or several apps or smart connected device to track some aspects related to their health. In comparison, traditional trackers are adults who measure on a regular basis one or several aspects of their health using means such as a notebook, a paper health record, a Word file, or an Excel file. Lastly, non-trackers are simply those people who do not measure on a regular basis any aspects of their health. So, can you guess the proportion of study participants in each category? In which category are you? So, the results show that 4 out of 10 respondents are in the first category. They are categorized as e-trackers. 26% belong to the second category, the traditional trackers, and 1/3 of our sample are considered non-trackers. Now, the question is, what's the profile of those e-trackers, and is this profile different from the other two groups? So our findings show that gender does not discriminate. Each group counts as many men as women. However, a majority of e-trackers are young adults compared to the other two groups. Just to make sure that you interpret this table correctly, for instance, the 60% indicates that 60% of all adults aged 18-34 are e-trackers compared to 13% for traditional trackers and 27% for non-trackers. The highest proportion of e-trackers can be found in Alberta and the lowest proportion in Quebec. Being an e-tracker is highly correlated with family revenue as well as education. As for the main occupation, while e-trackers are active professionally speaking, either as workers or students, traditional trackers are mainly retired people. Last but not least, 43% of those who do not have chronic diseases are e-trackers, compared to only 20% for traditional trackers. The only question we ask non-trackers besides their profile is why they do not measure any aspect of their health. The main reasons they provide us were the information that my physician gives me on my health is sufficient. It is of no interest to me, so a lack of interest. I am in good health or excellent health, so I do not see the point. I have other priorities in my life at this time, and I am not disciplined enough for this kind of activity. The first category of questions we asked e-trackers was related to their use of mobile apps. As you may know, there were many thousands of medical apps available on Apple Store in 2015. So, when all age groups are combined, 32% of our respondents, that is 38% of those who own a smartphone or a digital tablet, have used at least one mobile app to monitor aspects of their health in the last 3 months. In the US, a study conducted in 2016 by Accenture found the same result. Our survey found that 11% of those who had mobile apps on their phones or tablets for tracking certain aspects of their health did not use them or stopped using them in the previous 3 months. A significant portion of this group, 47%, said that after a while they lost interest. Interestingly enough, as we can see in the pink section of the table, issues related to security and confidentiality were not among the top reasons for stopping using those applications. With regard to the number of applications that are used, most respondents used 1 or 2 apps to monitor their health. Most interestingly, 62% have used mobile apps for less than a year, which clearly indicates that this is a very recent phenomenon. When we asked them, which of the following items do you currently monitor with the help of your mobile apps, the first item that came up was the regular physical activity, followed by nutrition and eating habits, weight-related information such as body mass index, followed by sleep patterns and performance in sports and competition. As you can see on this table, the medical parameters such as cardiovascular, lung, respiratory data, or diabetes, and so on, comes much lower on in the ranking. Not surprisingly, then, the use of mobile health applications is mainly the result of motivation tied to well-being, the ones that you can see at the bottom of the table, rather than motivations related to health problems, which are the ones at the top of the table. So the top reasons or motivations for using mobile apps for health purposes are daily encouragement to reach personal goals, monitor progress with made in one athletics training, and break a bad habit related to health. You must remember that 90% of e-trackers said they were either in good, very good, or excellent health condition. We then asked our respondents, do you ever share the data recorded in your apps with other people? Our findings show that only 35% said they did. And when they do, it is primarily with family members and friends. Only 1/3 of those who share health data do so with their physician. The overall satisfaction of users is apparent with their intention to continue using mobile apps in the future, as shown on this slide. The main perceived benefits associated with mobile app usage are a better understanding of one's own health, feeling more confident taking care of one's health, having more informed discussion with the doctor, and a decrease in anxiety about the health. The first two are closely related to what is called as the patient empowerment or patient engagement movement. The second category of questions we asked e-trackers was about their use of smart connected devices. So we weren't sure when we conducted the survey that Canadians would have a clear understanding of what we meant by smart connected devices. So that's the reason why we provided them with a definition. As you may know, there are many examples of smart connected devices, such as the smart watch or the bracelet, the scale, the smart toothbrush, which monitors your brushing performance, and you can also share your scores with your dentist, glucometer, the smart clothes, oximeter, spirometer, pedometer, blood pressure monitor, thermometer, intelligent pill dispenser, and the intelligent fork, which monitors your eating habits, mainly in terms of speed and the time between each bite. So, at the time of our survey, 86% of adults with a smartphone or a tablet had already heard of smart devices for tracking health aspects. But the level of familiarity with these devices was rather low, as shown on this slide. Very few respondents said that they were very or extremely familiar with these tools. Currently, 1 in 4 Canadian adults, or 33 of those who possess a smartphone or a tablet, own at least one smart device that captures health data. This finding is similar to results observed in other surveys. When we asked them for which reason do you not own smart connected devices, respondents answered because they are not interested, or those tools are too expensive, so cost is important. The third reason is also interesting, lack of enough knowledge about the benefits of these smart devices. And then reasons associated with the reliability of the data and security reasons. So those are the top 5 barriers to adoption. At the bottom of the slide, you can see that 85% of those who do not possess any smart device say that they do not intend to acquire one within the next 12 months. I think this is a data that is interesting for technology providers. Now, when we ask them how many devices do you currently use, not only own, but use, most said 1, and a few said 2 or more. And 54% have used their smart devices for less than a year. To date, the most popular smart device, as you can see on this slide, is by far the bracelet or the watch, which is owned by 88% of those who possess at least one smart tool. In second place comes the bathroom scale, followed by the pedometer, the blood pressure monitor, and the toothbrush. And as you can see, the intelligent fork comes last. Not surprisingly. Like it was the case for mobile apps, a vast majority of our respondents said they intend to continue using their smart devices to self-track their health in the future. And their satisfaction is also associated with the same benefits as for mobile app usage. So a better understanding of their health condition, greater confidence in taking care of themselves, less anxiety, and more informed discussion with their physician. Interestingly enough, 25% of those who own a smart connected device had stopped using it at the time of the survey. This finding is consistent with a study conducted in the US in 2014, which reveals that 1/3 of smart connected objects end up in the dryer after 6 months. it then becomes relevant and important to ask who are those individuals who are inclined to abandon or stop the use of their smart devices. Any idea? Well, our results show that it has nothing to do with gender, age, region, revenue, education, or occupation. But it is highly significantly related to poor health status and chronic disease. So a plausible explanation for that result may be that people just don't like to be reminded on a daily basis that they are not in so good health condition. So, in summary, our findings show that 40% of our sample is composed of e-trackers, 26% of traditional trackers, and 34% of non-trackers. 32% of Canadian adults use mobile apps to monitor aspects of their health, and this is in Alberta, where we find the highest proportion, and in Quebec, where we find the lowest. In terms of smart devices, 14% of Canadian adults use these devices to monitor aspects of their health, and again, it is in Alberta where we find the highest proportion of users, and in Quebec, the lowest. Interestingly enough, the proportion of mobile apps user is significantly associated with age. So 60% of all young adults age 18-34 are using mobile apps. And in terms of smart connected devices, as we saw earlier, there's a strong correlation with revenue. So what are the implications and contribution of this study? So an interesting fact is that the very same day the report of this study was released on September 19, a journalist wrote an article on the web titled, "Canadian Study Finds Health Isn't Serving the Right Populations." So I was very intrigued by that paper, and in fact I was very puzzled. So I suppose this is one way to look at our results, but I personally have a different interpretation. So when we look at the following table, we find that because of mobile apps and connected devices, more people, especially younger adults, monitor their physical activity, eating habits, sleep patterns, and their performance in sports and competitions. While we also observe that a higher proportion of Canadians are still using traditional tools, such as notebook, paper-based health record, to monitor the medical parameters. So, what those results tell us? To me, this is very encouraging because we know that doing physical activity on a regular basis, eating healthy food, helps us maintain a healthy weight, which altogether reduce by 80% the risk of chronic disease, according to many WHO studies. So hopefully, self-tracking using mobile devices such as apps and connected devices will help younger adults stay in good health condition for several years, if not for their whole life. So, our findings reveal that so far, as of today, self-tracking with mobile technology is more about well-being than illness or conditions. But we may ask ourselves, what does tomorrow hold? More and more companies invest in the development of smart devices that capture medical data like this watch, which won the Best of Innovation Award at the last Consumer Electronics Show in Vegas in last January. The watch, developed by a French startup called PK Vitality, has microneedles of 0.5 millimeter long, and in contact with our skin, it extracts some fluid that envelopes our cell tissues. This liquid contains several biomarkers, such as glucose, which the biosensor will analyze. With a simple touch pressure on the watch, sensors penetrate the skin and extract a small sample of this fluid, which is then analyzed by the system. If the user feels very light pressure on his skin, he feels no pain because the sensors never reach the nerves and blood vessels. This watch is expected to be available for sale in 2018. But technological development alone cannot guarantee that technology will diffuse among those with chronic conditions, like the journalist said. So another issue is, what about doctors? Will they prescribe mobile apps and smart connected device to their patients tomorrow? So there's no data currently available in Canada about this question. But in France, a recent survey shows that physicians and pharmacists do think that, or a majority of them, do think that smart connected devices can help them improve their patients' health. And they are, especially pharmacists, they are willing to consult health data generated by their patients' smart devices. In terms of the main benefits associated with the use of these tools, the one highlighted by that study is greater compliance with treatment protocol. And the main barrier, as we can imagine, and we can relate to that, is remuneration. Okay, especially we see this as a problem for physicians. So it will be important, in my opinion, to survey physicians and other clinicians in Canada to assess their attitudes, perceptions, and readiness towards usage of these technologies. So, in terms of contribution, the present study shows an opportunity to advance the health of Canadians through mobile apps and smart devices, and highlight important nuances to better understand key market segments and opportunities. Our findings also can be used to set the national baseline for future investigation on the diffusion of connected health technologies at the consumer level. Our findings are also useful for IT developers, as well as clinicians and public health administrators, to better understand the current digital market, the profiles of e-trackers, traditional trackers, and non-trackers, the value propositions these tools provide to users, and help system transformation. I would also like to add that it will be important to investigate whether self-tracking change people's overall approach to maintaining their health condition, and if so, to what extent and how. So I will leave you with the study highlights in terms of summary. So again, this is the first national survey on this topic and the largest ever worldwide. Findings indicate that 40% of Canadian adults are e-trackers, 32% use one or several mobile apps, and 25% own one or several smart connected devices. 14% actually use those devices. E-trackers are mainly young, highly educated adults with a family revenue above average and who consider themselves to be in good or very good health condition. Use of mobile apps and smart devices is a very recent, yet fast-growing phenomenon. And as of today, these devices are mainly used to capture physical activity, nutrition, weight, sleep patterns, and/or performance in sports. So aspects related to well-being. And the main perceived benefits are greater knowledge of one's own health condition and greater confidence in taking care of one's own health, which are key ingredients for a greater patient engagement and patient empowerment. I thank you very much, and I remain available to answer your questions and listen to your comments and suggestions.
Thank you, Guy. Those were very interesting findings and really great to see the level and depth of research that you've done on this, and especially given that this is the largest international study as well. So really great to see that. I just want to remind all the attendees you can type in your questions in the Q&A box on the right there, and I will pose the questions on your behalf. Maybe I will get started with a question that we've got here. This is more towards our sort of evaluation-oriented audience that are also on the line. How would you recommend or suggest integrating connected devices into research designs for primary care prevention, given that we were seeing that there is a portion of the population using this, and when we're thinking about primary care prevention-related studies, how can we consider incorporating this?
That's a very good question. Well, before we do any research on this topic, I think we must establish a baseline and have a better understanding of what the perception of family doctors or physicians is about this movement, because as you can see, this is a very recent phenomenon from a consumer perspective, and I think there's going to be a tsunami in the near future, and physicians won't have any other choice to jump into the bandwagon and consider the need of to analyze those data. But before we conduct any study, whether it is from a primary care perspective or a public health perspective, I think we need to do a national survey of physicians linked to their attitudes and perceptions and readiness, and how they themselves see how those technologies can be integrated into their daily practice.
Great, thank you. We've got a few more questions here. So the next one is, do you have any further insight on why people lost interest in using the apps over time? Did they feel the apps lost value or relevance to them?
Well, that's a very good question. And I guess many people have no clear expectations when they buy those devices or they download mobile applications. It may be more out of curiosity. So that may be one explanation. And maybe another one is that after a while, there's no more learning, so people can lose interest in the technology because of that. That would be two plausible explanations, in my viewpoint.
Okay. So there's a question here about seniors, who you said were the traditional trackers. Can you tell us a little bit more on that, or do you have any further insights on that group?
As we can see in the data that we collected, seniors are not the most important group of e-trackers. I think this is not surprising, in the sense that we find them more in the traditional tracker group, and I guess these people have developed strong habits of self-tracking their medical parameters or elements, and using tools like notebooks or Calpen or things like that. And they have not yet made the move to use electronic tools such as mobile apps. Or so I think there's potential. I know there are some experiments going on in Quebec with, one of them is with a pharmacist, and I think the reaction of those people age 65 and over, most of them have chronic conditions, is very positive. In fact, we're about to study them in the coming weeks. So we're going to conduct interviews with them to understand their viewpoints, their perceptions in terms of the benefits, the barriers they find associated with the use of those technologies, the difficulties they face, and so on. So we're going to know more about this group. One thing that needs to be done with the current data set that we collected, I mean the national survey that I just presented, we haven't analyzed the data specifically for this group of people aged 65 and over. So this is on my this is one of my priorities to do so.
Excellent. We look forward to some of those findings. We've got another question here.
Maybe one of the things that I may put more emphasis on when I present in Calgary in November.
Ah, excellent. Stay tuned. Did you have any questions in the survey that related to tracking mental health using apps, and what do you think the adoption is for those?
I think if I remember correctly, we had mental health as one of the items, but we didn't find anything about this. Maybe because of there's a sample bias, I guess. People with mental conditions did not participate in the survey. But definitely, I think there are interesting mobile apps on the market that target those patients, those people. So I don't see why there would not be any future for those people in particular.
Great. This might be along the same lines related to your analysis. Looking at the well-being versus medical use of devices by whether you have chronic disease or not, did you see a difference in terms of what the interest was for using apps?
I'm not sure I understand the question.
It's looking at well-being versus medical use of devices in the chronic by presence or absence of chronic disease. Was there a difference in more interest on using it for well-being for those without chronic disease?
Again, this is something I would need to explore further in terms of the analysis. As I said, 1/3 of the respondents said they had at least one chronic condition. I would need to look at those in particular and see if they have the same pattern in terms of mobile apps usage and smart connected devices usage as well. So I cannot provide you with a clear answer at this time, unfortunately. But my guess would be that we may see a difference, and I would suppose that in that group, those with chronic conditions, they would use those apps for more medical purposes than well-being. But this has to be checked.
Right. Great.
I have a question myself. I would like to know if what's your reaction to my own interpretation of the findings when the journalists say that the diffusion of mobile health does not reach the right population. Anyone would like to comment on that?
So because we've got the panelists for the attendees muted, I'll sort of give our reaction here. We definitely appreciated your interpretation of the data, and I think it's a very important capture of what the results say. And we were actually wondering if you would consider writing that response in a more public fashion to present these findings in light of what that journalist had presented. And I think it would be very valuable just in being able to interpret those results.
Okay, well, I think it deserves an answer, definitely.
Absolutely.
Yeah. I just want to make sure I'm not the only one with who interprets the data the way I present.
There were nodding heads here, as you said. This is the way I think we should be looking at this data. So, from the panelists, we're not hearing. We haven't gotten, or from the attendees, we haven't gotten any comments otherwise. But I do encourage, if anyone's got comments that you want us to pass along to Guy regarding the interpretation, feel free to type it in the Q&A, and we can share that with Guy as well.
Thank you very much.
No problem. And we've got maybe time for a couple more questions. You've generated a lot of interest among our audience. The next question is, the market of these devices keep changing with the introduction of newer devices. Do you have any knowledge of whether the e-trackers continue tracking their health even when the devices change? Perhaps they've acquired a newer device.
I have no data on this, but my guess would be that they do, especially with mobile apps because they're so cheaper than the devices. But because buying a watch or a bracelet is quite expensive, we saw that was one of the main barriers to adoption. But this is not the case for applications. So I would think that e-trackers are, especially because, as we saw in the results, they are younger adults, so they keep informed of what's new, and I would not be surprised that they update their applications on a regular basis. Yeah.
So I've got a question here about the population that we've been able to reach, being the e-trackers. And the question is, how do you propose exploring the non-trackers and the determinants of their readiness to e-track their health and well-being, given that that's a population that's hard to reach, but would be a valuable population to reach? So how would you go about, and are you going to explore that area as well?
Yeah, well, in our current study with the people aged 65 and over, we will interview e-trackers, traditional trackers, and non-trackers. So we're going to be asking them the same reason we asked the survey respondents, but we want to understand the why they don't self-monitor, and what are, in their view, the barriers to adoption of those technologies. Because this is, more and more studies show that there is a link between self-tracking behaviors and health condition. So a positive link, I mean. So I think I totally agree. This is very important. We have to understand, first of all, who these people are, and I think this is one contribution of the current survey, national survey. We have a better understanding of who they are, but we need to know more about them and what could be done to make them self-track one or several aspects of their health, considering prior knowledge on this topic. but this is not an easy task. I mean, to reach these people is not something easy.
Great. I think that's a good note for us to wrap up on your comments about some of the work that lies ahead and all of the questions that have come from this great piece of work. We've got some additional comments here that I'll share with you about areas that people are interested in seeing explored.
This is only the beginning, huh? This is the baseline,
exactly.
And now the real questions are to be investigated.
Exactly. So I think this is a great baseline, lots of questions, but also gives us a great sense of where we're at. And to answer those questions.
It's also reassuring to see that we are also aligned with what's going on in the States and elsewhere in the world. Especially, I didn't show them, but there are many surveys that were conducted 4 or 5 years ago in France. In fact, France was the first country to be interested in this area called connected health or digital health. And but I didn't show the results of those studies because they were kind of outdated. But when we look at the results, we see that we're doing very well in Canada, and the same with the German study.
That's great. Well, I want to thank you very much for your time and joining us on this forum to present this very interesting research. And I want to thank all of our attendees as well for your insightful questions and for joining us today. We will, as I mentioned before, if you're interested in joining our network and attending future webinars, feel free to contact us with the email evaluationservices@infoway-inforoute.ca. Thank you everyone for joining, and I hope you enjoy the rest of your day.